We believe in fighting hard for consumers in every area of the marketplace, and I can't think of a more important consumer area than health care. And we want to make sure that everybody in Illinois, when they seek to get a health provider, a doctor, has full information about who they're dealing with, their background information about them. This is a very important, I think, step forward for health care in Illinois, and definitely for the families of our state who are raising children, seeking medical care not only for their children but for themselves. It's important that we know as much as possible about those who are providing that care. And this is a landmark law that I signed about 60 days ago, I guess. And we're here today to kick off the website that will be available to anybody in Illinois. This is electronic democracy at its very best. The wonders of the internet and the opportunity to learn information very quickly on your fingertips, from your own home or wherever you might be seeking the information from, at work, you name it. Here's an opportunity to use the power of the internet to provide more information to people on something that's vital to their lives.
Within the University of Illinois Hospital and Health Sciences system, we know that we can accomplish tremendous things through the combination of our world-class research, acclaimed health science education programs, and high-quality, cost-effective health care. But we also know that across our state, and certainly across the street here, there are communities that do not receive the health care that they need. At the University of Illinois, we believe we can and should be effective for all people through the provision of health care that is more proactive, more personalized, and more accessible. We have renewed our commitment to addressing health disparities, not only with medical technologies and advancements, but working with our communities to find better solutions. This commitment to improving the health of at-risk populations is deeply ingrained in our institutional mission, and we thank the Governor for sharing this commitment and for being with us today. Thank you.
When Governor Quinn signed the Physician Profile Revitalization Bill about 60 days ago, I commented that it can be easier to find information about a dishwasher than to find information about a doctor. Well, today, Illinois takes a significant step towards narrowing the gap between information about doctors and information about dishwashers. The physician profile contains over 20 fields of data about the 48,000, nearly 50,000 actively licensed doctors in Illinois, ranging from such topics as insurance accepted, criminal convictions received, and whether the office offers translation services. We are optimistic that Illinois residents will actively utilize this service. When the physician profile was live until 2010, it was receiving on average 150,000 hits per week by over 48,000 visitors. Now, this rate has been exceeded, in fact, in the first 12 hours of the profile's operation, exceeded by about 3 times, in fact. And Representative Flowers, I think, will give you a stat on that. The physician profile is founded on the premise that every person is entitled to provide informed consent to medical treatment, not just informed as to the medication or procedure, but informed as to who will be providing that particular treatment.
This bill would not be successful if it were not for my colleagues in the Illinois House as well as the Senate. So in the absence of those that's not here, I would like to thank them for their years of hard work. This bill has been a work in process for about 15 or 17 of the best years of my life in the Illinois House of Representatives. And if I had to do it all over again, I would do it the same identical way. I would like to also thank the Tribune, the Sun-Times, and other newspapers who ran horror stories every day, about patients. If only they had known that their doctor had a criminal background, they would not have gone to that rapist. If only they had known that their doctor had lost his license in another state, had they known that he had lost his license in another state, they never would have gone to that veterans hospital that caused the death of so many people, if only they had known. And we always say, well, you're the patient, you should have known, you should have had the opportunity to find out. There was no way. We have 102 counties, and we would have had to go to 102 places to find out about these doctors. As a result of this website, as it was stated, it hasn't been in place for 24 hours, and already we've had 50,000 hits. 50,000 hits. So this is just the beginning of a lot of patients in the state of Illinois whose lives will be better because they will have this information. And I must say, there's an old saying that it's better the second time around. Well, this is this bill's second time around, and it is better. The website is a lot easier, the information is more accessible, and I'm looking forward to pressing the button. Thank you very much.